Okay, I'm going to give you an example of the pay or play concept. Basically, how do you calculate full-time equivalents? We're going to take a hypothetical employer who has 90 employees, 20 of whom are salaried managers. Salaried managers are salaried at 40 hours. They have 70 hourly employees. Their policy is a January 1st renewal, their health insurance policy. They've chosen a 6-month measurement period. And so, as I said before, you start with your implementation date and work back 6 months. So their measurement period is July 1st to December 31st. What do? Well, first thing you do is you say, who's a full-time employee? I know they're a full-time employee. I'm not going to be able to argue my way out of that one. And you say, all right, they equal 1 full-time equivalent apiece. The fact that they work 40 hours and not 30 hours is irrelevant. They're not 1 1/3 full-time equivalents. No one can ever be more than 1 full-time equivalent. Then you look at it and you say, who consistently works over 30 hours? So you have hourly employees, but they're full-time employees. They work 40 hours a week. They, somewhere between 30 and 40 hours. You expect them to be there all the time. You don't go through this full-time equivalent calculation for them. You just throw up your hands and say, okay, they're a full-time equivalent as well. That leaves you, well, you also have your seasonal employees that I mentioned earlier that you need to be very careful about. If you have seasonal employees, you pull them out of the calculation, they're 0 full-time equivalents, leaving you with a pool of variable hour employees. Even if you know the variable hour employees aren't going to work 30 hours, it doesn't matter. What we're calculating here are full-time equivalents. If they work 1 hour a week, they're 1/30th of a full-time equivalent. So you add all the hours for all such employees. You can do it in the aggregate, but you really don't want to do that because you're going to need to have the information on a person-by-person basis later. So you have to do it by person or person by person. Any hours worked in excess of 30 hours a week or $120 a month, you can round down to 30. In other words, when you do this calculation, if someone works 35 hours in a week, he's going to come up as more than 1 full-time equivalent. When you do the calculation, you don't want to do that. Round everybody down to 30 hours a week. What you will have is a big spreadsheet, or your National PEO client will have a big report that'll list every hour everybody worked, how many pay periods they worked, that kind of thing, and we do the calculation from there. Then, once you have this total number of hours all these people worked, you divide it by the total number of hours they would have worked if everybody had worked 30 hours in every week. So in this case, I'm using a 6-month measurement period, so there's 13, what did I get, 13?
13 pay periods.
Oh yeah, 13 pay periods, because I should have mentioned they were biweekly, and 6 months. So you can do it in the aggregate, and you can use months, you can use pay periods, you can use weeks. I recommend you use weeks. One of the problems is the legislation says 120 hours per month, but most of you probably know that except for February, there's more than 120 hours in every month. So if you add up all their hours and divide it by 120, you're going to get a bigger number than you really should get, so you don't want to do that. It's best to break it down by week. If your information is aggregated, just say, okay, how many weeks were in that period, and divide by that. Here is the example. There's 70 employees in this company. My skills with PowerPoint are not good enough to make a 70-line graph. So I've shown the first 4 people individually, and then everybody from 5 to 70 I added up in total. Each employee I show by month how many hours they worked. When you go to the total column, which is bolded, although not that obviously bolded, you can see how many hours each one of these people worked, and then the aggregate for the other 66. Employee number 1 worked a total of 805 hours during this period. The total amount of hours you need to work to be a full-time equivalent is 780. That's 26 weeks times 30 hours a week. So this first guy worked 805, so he is 1.03 full-time equivalents. And I know I told you it can't be more than 1. I'll get back to that in a minute. These other people, what?
I'm good. I'm just pointing to where you are.
Is he doing stuff? Sorry, I changed these slides last night. Oh, I should say, by the way, the math isn't going to work on some of these because I changed them last night. I didn't have the patience to go back and recompute all the totals. Get the point. Don't worry about it. Don't send me cards and letters. This doesn't add down. because yes, it doesn't add down. So this guy's 1.03, and everybody else is a 0.46, a 0.61, a 0.51. That whole big group adds up to 4461 for a grand total of 47.22 full-time equivalents. Now, you know that number's high because there's several people in here who have more than 120 hours in a month. And for this purpose, let's assume all months are actually 4 weeks long, and so 120 is the right number. In fact, in some months, 130 hours or 140 hours is still going to be the number of hours in a month. So the next thing you do is you go through and you eliminate everybody who's working more than 30 hours so that you're back down to just nobody can be more than one full-time equivalent. When you do that, you see this guy, employee number 1, drops to 667 hours. Employee number 4 drops to 470 hours. Now nobody is going to count as more than one full-time equivalent. And when you add the whole thing up, now it's only 45.97 versus 47.22. Now,
Their numbers don't match that, but that's all right.
oh, well, darn it. That's what I did last night. I told you the numbers don't work. And anyway, the point is the second slide, the numbers should be smaller than they are in the first slide.
And the only reason why they're smaller is we've taken out the excess. For people who had more than the 30 hours a week or the 120 in a month, we've chopped off their excess and brought them, even though they're hourly, back down to no more than 30 hours per week equals 1. So it shrinks the overall count of the hours.
And I can tell you that in real life, the difference between the before and after 30-hour limit is going to be much bigger than it is on my slides. It just tends to have a very large impact. So you say, okay, 45.97, does that mean I'm not a large employer? Well, you forgot about those 20 people that were full-time employees, so you have to add them back. And in fact, just to back up for that slide for a second, remember that first employee, if you go back to the slide before that one, you can see that guy had 805 hours. He actually is more than a full-time equivalent in real life. So when it comes time to look at who are your full-time employees, not your full-time equivalents, he's going to count as a full-time employee. Everyone else is going to end up being something less than a full-time employee. And you'll see where that comes into play in a second. So this company has 65 full-time equivalents. So are they a large employer? Yes. They now are subject to the employer mandate. When it comes time to offer, now what do you do with that information? You have to offer, the significance of this is, you have to offer insurance to anyone who shows up as a full-time employee. So in this case, your 20 full-time employees who are the salaried managers are obviously full-time, and that one variable hour employee who is more than one full-time equivalent before you made the adjustment and reduced his hours. He's a full-time employee. They have to offer insurance to 21 people. Did I lose anybody there? Totally. Okay. I told you it was going to get more complicated. Okay, so you look at every employee individually. In my example, employee number 1 is the only employee who is working more hours than the minimum number to be a full-time employee. A full-time or a full-time equivalent. A full-time equivalent, 30 hours times 26 weeks, because this is a 6-month measurement period. And you can pick any measurement period you want, but whatever you pick, you got to pick it for everybody.
So real-world application, this is an employee who averages 32 hours, 36 hours, 31 hours, 34 hours, and even though they're not full-time and their hours vary, they're still consistently going to show up as a full-time employee. They just count as 1. So we can break them down into just 1.
Exactly. This is the calculation for variable hour employees. The first thing you do, you say, who are my full-time employees? And then you don't put them in the variable hour pool. Then you say, who do I think or who do I know is going to always work consistently over 30? You take them out of the pool. In your case, you haven't got anybody left. Yes, if they're really like 30-hour or 25-hour employees, they're part-time employees, they do come into play in the full-time equivalent calculation, which is only used for determining whether you're a large employer. But when it comes time to offering insurance, That's where the distinction changes between a full-time equivalent and a full-time employee. Only full-time employees get offered insurance.
Do you have to classify them as part-time employees?
No, you can call them anything you want. It all depends how many hours they work. So you can say you're part-time at 39 hours, you're still going to have to offer the guy insurance. Now, did that help? Anybody still have a serious migraine? Okay. So again, and just to recap this, that guy, that employee number one, who at the time had 805 hours, for purposes of the full-time equivalent calculation, you don't have to use all 805 of his hours. You can bring him down to 30 hours a week max to bring down your full-time equivalent numbers. And we're back to that. So, summarizing what I was saying, the 20 full-time employees, because I said in the example they were full-time employees, they have to get offered insurance. Everybody who averages over 30 hours, and that's why you want to do this by individual, that total calculation individual, so you can look at that calculation and say how many of those people ended up being over 30 hours average because they were more than one full-time equivalent before I got rid of the 30-hour limit. You have to offer that guy insurance too. Okay.
Okay.
All right, hang on.
So Kevin, in your example, that guy that was a 1.3, you could effectively just change him to a 1, right?
He is a 1.03 for purposes of determining whether you offer him insurance.
Right.
But you can reduce him to a 1, but you don't want to reduce him to a 1 because there may be some periods in which he actually worked less than 30. So he would actually be, in fact, in my example, he's like 0.97 because he didn't in every single month exceed 30. Know what I mean? So you're better off bringing it down to 30 and then in a month where he didn't, or a week he didn't work 30, use the 25. Don't just round him off to 1 for the whole year because it's going to hurt your overall calculation.
Does this just apply to W-2 employees or to 1099 employees?
This applies only to W-2 employees, but a 1099 employee is a bit of a misnomer. A 1099 is not an employee; they're an independent contractor. So if they're an employee, yes. But if they're really an employee, but you're treating them as a 1099, you're just taking a big risk because the IRS will come in and say he's not a 1099, and they're big on that right now. IRS is huge on misclassification of employees as independent contractors. You may think your only risk is they're going to go make you pay the taxes on the independent contractor you didn't withhold. If you have health insurance, they're also going to make you go through your full-time equivalent calculation and see if you lied about whether you were under 50 or not. So the stakes got higher for misclassification of employees. But if they legitimately are at 1099 and they pass the 20-point IRS test, no, they don't come into this, play in this calculation. Now, yeah, let's just say that. If they're from, say, a temp agency and you're 1099 a temp agency, they still may be your common law employer, but employee. But if they truly are a contractor and you don't control them, then you can't be the common law employer because you're really not controlling them. You're not an employer at all. Okay, there is also what's called a stability period. When you choose your measurement period, you are also choosing your stability period. The stability period is what happens right after you implement healthcare reform, and it tells you how long am I required to continue to offer insurance to the employees that I offered to on day one. If you pick a 6-month measurement period, your stability period is also 6 months. If you pick 12 months, stability period is 12 months. Can't be any less than 6 months, though, so if you pick a 3-month measurement period, your stability period is still 6 months. What's the significance of that? You go through this variable hour calculation, and you've got people that show up as being over 1 full-time equivalent because that's what happened during the measurement period. Well, maybe the next 3 months, they just don't work very many hours. And maybe they decide they're going part-time or lesser part-time. You still have to offer them insurance for the balance of the stability period. Now, if they terminate, and I get this question all the time, do I still have to offer them insurance? No. As long as they're your employee, even if they're part-time, you can't cut off their health insurance until after the stability period is over. So you may get a benefit out of using a longer measurement period because of turnover issues. If you got people that are constantly coming and going in your workforce, they're never going to add up to a full-time employee, a full-time equivalent in your calculation. If they're only there for 3 months of your 12-month measurement period, they're never going to turn out to be more than 0.25 of a full-time equivalent. So it may be in your best interest to use a longer measurement period to take advantage of that fact and to hope people turn over enough that they don't show up as a full-time equivalent. But if they are there, you're stuck allowing them to participate in your health insurance plan and all the money that you paid for their share for a 12-month period. So that's something you're going to have to think about on an individual basis. We can certainly help you think your way through that as to what the best period is. But the reason they did that, obviously, is to keep you from being able to cherry pick and take the best measurement period and the best stability period and basically negate a lot of the impact of the law. So that's that. I already explained that. Okay, so say you have an employee then, and you're offering him health insurance. The 6-month period expires, and you say, aha, this guy hasn't worked 30 hours in 6 months. I'm not going to offer him health insurance anymore. You can tell him he no longer qualifies for the health insurance plan. That expiration of the stability period, in his case, is a qualifying event. A qualifying event means he can go to the exchange and get insurance there now if he wants, assuming he's still employed. If he's not employed and you terminate him, he goes and gets COBRA, or he goes to the exchange and gets his insurance. He can go to either one now. COBRA does not go away.
That's an important thing to mention. I know I talked about the individual exchange. It does have an open enrollment period and an annual renewal, so that's your chance to sign up as an individual for the exchange. Otherwise, you have to have a qualifying event like the birth of a child, you get married, etc., in order to be able to go on an individual program through the individual exchange. It's not like you can find out you got sick in March and then sign up for health insurance just because of that. You would have to have a qualifying event, or you would have to sign up at the next open enrollment.
Part-time and full-time depending on their status. For instance, we've got one that's been full-time. She's decided she wanted to go work in another department, but only a part-time position is open. Do we still have to, under this new law, cover her for the 6-month stability period, or at least the minimum, even though it was her choice to go part-time, not the employer's?
Yes. If she shows up in the measurement period as a full-time employee, you have to offer the insurance during the stability period as long as she continues to be employed, even if she decides she's the one who wants to go part-time.
Now, because our employees have to pay a portion of their insurance, if she decides going to part-time that she cannot afford this, do we still have to cover it? Or is she still mandated to pay that employee portion?
Well, that's kind of a better question for Kevin Johnson here, but traditionally when you sign up for health insurance, you sign up for a policy year. You're not allowed to decide you don't want insurance anymore just for kicks. But I suspect that there will be a qualifying event type provision in policies so that people can get out if they're no longer full-time. But that isn't the case right now, is it, Kevin?
Well, yeah.
Usually there is an element of this big list of qualifying events that says if you have a significant financial change, if the plan becomes significantly more expensive to you, that's usually a way out of it. Now, remember how I talked earlier about the rules versus the reality? The reality is if you submit somebody on a terminate this employee's health insurance form, they get terminated. But realistically, if there is a genuine situation, I would expect that should qualify. If that's why this lady can't do it, if she's still making basically the same income and all of a sudden she just decides she doesn't want it, it's a harder thing to get out of playing by the rules. Yeah, significant loss of income is considered a qualifying event.
Okay. I should have directed the question to him originally. Anybody else? I thought I saw their hand there. Yes.
So if you have a 6-month stability period, January 1st through July 1st, and you figure that out and you redo your, you look at somebody's new hours over that period and they work less than 30 hours and they were full-time before, you can say, I'm sorry, you're not covered anymore. Then they go out to the exchange and you have to pay for one less person.
Exactly.
That's
at the end of the stability period. If they quit working the hours the first month, you're stuck with them for 5 more months. Okay. And what Kevin was alluding to is we have more power than our ability to report a termed employee we can report a termed employee as termed if we've got any kind of a legitimate reason at all, even if the carrier wouldn't necessarily approve. We don't ask them for permission. We just do it. Okay, and now to make things a little bit more complicated, but also to provide you with some relief, there is such thing as an administrative period. You can elect an administrative period up to 90 days, and you stick it in between your measurement period and your stability period so that you have 90 days to calculate all these measurement period calculations and figure out what you're supposed to do before your stability period starts. You can't reduce the stability period or reduce the measurement period. You just have to stretch it out and stick the administrative period in the middle. You don't have to use all 90 days. You can use anything less than that. But if you have to implement on January 1st, 2014, you can't start your administrative period on that date and end up technically not implementing for 3 more months. You'd have to make the last 3 months of the year your administrative period and then tack your measurement period onto the beginning of that. So you're technically up to 15 months or something. And if you're doing the math in your head, if you have to implement on January 1st, 2014, and you back up 15 months, you're already 4 months into your period. So if you thought you had something you can do to help the situation, you're already 4 months into it. And that's why the government said, we're going to give you a break. Pick any 6-month period you want, and you can still, pick your own stability period. Okay, yeah, it just allows you to do the calculations, can't exceed 90 days. Okay, so here's where the rubber meets the road. What are the penalties? The government says you got to do this, so what? Just because you said, well, what's going to happen? All right, there are different kinds of penalties. There's the coverage not offered at all penalty, and then there is the less than minimum value coverage offered and the coverage not affordable penalty. Penalties are payable monthly, so when you see the numbers, it's not like you have to get out your checkbook and write a check then. You're going to get a bill for 1/12 of it every month. First penalty, before I'll back up to explain those 2 comments earlier. Minimum value benefits are a policy that has essential health benefits in it at least a 60% actuarial value level. So rule says you have to offer at least a bronze level policy. That's what it means. If you don't offer a bronze level policy, but you do offer a policy, you're still going to be subject to a penalty. But you won't be subject to the coverage not offered penalty, which is more draconian. So just to clear that up. And then once you've determined that you've offered a bronze level policy, and therefore you're covering 60% of the cost, or the policy is covering 60% of the cost, then it comes down to what I was saying earlier. Now you have to decide how much are you going to pay of the premium, because if the cost of the employee is more than 9.5% of that employee's household income, you're subject to a penalty. If, and I don't have an example on this, but you can, the first question that comes to mind is, how do I know what my employee's household income is? Household income is basically their adjusted gross income on their tax return. Well, you don't know that. You only know what you're paying the employee. As a result, the government said, if you want to use one of these safe harbors, we'll assume you made every effort you could possibly have made to figure out whether or not your employees are making less than 9.5% of your premium. First one is you can look at box number 1 on the guy's W-2 and say that's how much he's making, and use that for calculating whether or not the premium you've left to him is more or less than 9.5%. Problem with that, of course, is that box 2 is net of the health insurance premium the guy's paid. So the guy pays, so that number is a little smaller than it has to be. There's going to be more people that fall under 9.5% if you use that box than if you just use his paycheck. Also, you don't know what it's going to be by the end of the year. You could use the prior years, but there is no safe harbor for that, so you just have to be sure you got it right at the end of the year. The most popular one that everyone's going to use is the rate of pay. If you pay the guy $10 an hour, you know he's going to work 1,000 hours a year. You know his income is $10,000. You know you have to get your premium cost to him below 9.5% of $10,000 to qualify. There are exceptions, and we'll get there. Or if the guy's below the poverty line, which in the example I just gave you was, you can assume that you're not subject to a penalty, because if he tries to get insurance from the exchanges, he's going to end up on access or Medicaid. Yeah. Okay, what is the penalty for not offering insurance? Serious penalty. For every full-time employee you have, $2,000 minus a year, minus the first 30 employees. So if you have 50 full-time equivalents, you have 35 full-time employees, you can get a penalty, a bill for those 5 employees over 30 times $2,000. Now, that's a very small number. Most of the people will give you a calculation where you have 200 employees and you end up paying $300,000 to the government. You can exclude offering coverage to 5% of your employees. Now, why would you do that? How would you do that? It's kind of hard to imagine a lot of those situations, but if you have an employee in Anchorage or something and you can't get an insurance policy just for him, it's okay if you don't offer the policy to him as long as you have, he constitutes less than 5% of your workforce. So when they say you have to offer it to everybody, you actually get a 5% cushion in there. There are anti-discrimination laws that I'm sure are going to say you just can't pick the people you don't like, you just can't pick the women, you just can't pick the old people. That kind of thing's not going to be possible. When do you get charged for the subsidy? Well, if you're really lucky and you don't offer insurance and none of your employees want insurance, they don't go to the exchange, or they go to the exchange but they all make too much money to qualify for a subsidy, which is 400% of the poverty line, then you can't get a penalty. Because you don't get penalized until the first employee of yours shows up at the exchange and says, I want health insurance, my employer's not offering it, and I don't make enough money to pay for it. That's when you get the bill. The reason for that is because this is a self-reporting thing. The government's going to let you report whether or not you're eligible, what kind of policy you offer, who are you offering it to, that kind of stuff. The government doesn't want to spend a lot of time worrying about that if you're never going to end up paying a penalty anyway. So as soon as the first guy goes to the exchange, and I should maybe jump ahead, the exchange is going to get online with the IRS and say, how much did this guy make? And do they offer a health insurance policy? Because you will have already told the government whether or not you offer a health insurance. Then, oh yeah, they're going to say, what does he get on his tax return? They're going to find out if he qualifies, and if he does, they're going to send you a bill. Oh, and this is another goofy thing. I don't think this is really going to come into play much, but when you offer coverage to your employees, you only have to offer it to the employee himself and any dependents he has under age 26. You do not have to offer spousal coverage. I can't imagine an insurance company issuing a policy that doesn't provide for spousal coverage, but you don't technically have to offer that. When you do the calculation on the 9.5% of income, it is the household income, which will include the spouse. Again, you don't know what it is. That's why they have the safe harbors. Now, going back to my example that I did before, if you recall, there would be no penalty for that employer because he had 20 full-time employees, one guy that was more than a full-time equivalent, for a total of 21 full-time employees. When he does his calculation, he gets the first 30 for free. So despite being a large employer and having 21 full-time employees, he's exempt from penalties in the event that he doesn't offer coverage, or if he offers coverage and it's inadequate. Now let's talk about the other penalty, which is if you do offer coverage, but it's not of the right minimum value, it isn't 60% in other words, or it's more than 9.5% of what your employees can pay. $3,000 per full-time employee goes to the exchange and gets a subsidy. So there is no 30-person safe harbor here. First guy goes to the exchange, gets a subsidy, you didn't offer him a policy, or you offered him a policy and he couldn't afford it because it was more than 9.5%, you get a bill for $3,000 spread out over 12 months. Maximum penalty, of course, is limited to what would happen if you never offered any coverage at all, because it wouldn't be fair to have a penalty that was higher for offering coverage that wasn't as good than it would be to not offer any coverage at all. So it's limited to $2,000 per full-time employee. Let's talk just for a second about small employers. Is there a question? Yeah. Microphone?
So this particular calculation, if we have less than 30 full-time employees, but more than 30 full-time equivalents, this is based on employees versus equivalents.
Correct. If you have more than 50 full-time equivalents, you may be a large employer, but if you have less than 30 full-time employees, you can't be found, you can't have a penalty for not offering the coverage to them. So you get those 30 free if you don't offer coverage at all, but if you do offer coverage, since it can't be any more than the no coverage penalty, you get to skate by on that one, even if otherwise there'd be a penalty. So less than 50 employees, there is no employee mandate. Small groups must still include essential health benefits any offering. Again, it's not going to be your choice. It's going to be whatever the carriers are offering. Now let's talk about the individual mandate. Keep in mind, I should just point out, we'll talk about that in the strategies bit, just because you don't offer it to somebody or because it's more than 9.5% of his income doesn't mean he's going to go to the exchange and get a subsidy. A lot of people are just going to say, why do I want to pay the employee portion of this? I don't care if it's more than 9.5%. Even if it was less than 9.5%, I wouldn't want it because I still have to pay the employee portion. So they don't go to the health exchange. They don't do anything. They don't want insurance, period. Well, you can't skate totally because there is the individual mandate. Individual mandate says if you do not obtain health coverage either from your employer or from the exchange, you pay a tax penalty instead. Theory, of course, being if we can get everybody into the plan, including all the young, healthy people who don't want health insurance, those people will subsidize the older people, and that's how health insurance reform actually brings down rates over the long haul. That's how healthcare costs come down. You get these healthy people paying that don't otherwise want insurance. So they created this incentive to make everybody come up with insurance. Unfortunately, the incentive phases in, and it's very small. So in 2014, if you're an employee and you decide you don't want health insurance and you'll just pay the penalty instead, you only have to pay $95 or 1% of your income. In the year 2015, it jumps up to $325 or 2% of your income. And in 2016, $695 or 2.5% of your income.
I just want to mention there too, though, that if you're a high income earner, that 1% in 2014 or 2% in 15 and so on is going to be substantially higher than the $95. I mean, say if you make $109,750 in 2014, 1% of that additional $100,000, it's $1,000 penalty in your tax return. Not $95.
Right.
So it's not so bad for a low income earner. It's pretty bad for a high income earner.
Yeah. However, it's still going to be less than the cost of insurance, probably, for most people. So there's going to be a lot of people that just opt out of the system altogether, and even though you didn't cover them, it's not really an issue. So keep in mind, strategically, there's going to be, when you set your contribution level for your health insurance, you're going to want to take into effect how low do I have to set it? Do I have to hit it so every single employee is under 9.5%? No, you can set it higher than that on the assumption that some of those employees don't want health insurance and aren't going to get it, and you'll never come back to haunt you anyway. Dependents are half off. They're having a sale on dependents. Because remember, this counts as every individual in your family. It's not just you, everybody. Now, there is a maximum per family, so when you do this everybody in your family calculation, you'll never have to pay more than 3 times the single person amount, which, if you look at these numbers, is what that all works out to.
I have another question. If your employee is covered by their spouse's insurance, are they still your employee?
If they're covered by their spouse's insurance, they're still your employee, and you have to offer them coverage, but they're obviously not going to take it, or you can't make anybody take it. In fact, that's actually something I should have mentioned on an earlier slide. You cannot make people take the health insurance. If it's a union plan, say, and everybody who works there has to be in the health insurance plan, then that doesn't count as a qualified plan because you haven't offered it to them. You've jammed it down their throat. I don't know how often that's going to happen, but that's the rule. Okay, now I'm going to talk briefly. Oh, sorry about that. I thought he was.
At my company, we have a lot of people who are on Access, for example. And they're going to ask this question, are they going to be penalized when they do their taxes if they are on Access? I know that question will come up. So.
No, because they're exempt from the law. So they're required to have insurance through their employer or through the exchange unless they don't have to have insurance. In this case, if they're on Medicare or something like that, or Medicaid, Medicare? Medicaid.
Medicaid, that is their insurance.
Yeah, that counts as an insurance policy, so they're off the hook. Okay, so I'm going to talk about this very briefly because we are undoubtedly going to have another seminar between now and 2014 because we've really sort of just talked about what's going to happen on 2014. But after 2014, what happens when you hire an employee? For those of you who are just thinking, oh yeah, I never really thought about that. What do I do about that guy? He missed the measurement period. The answer is, if he's a full-time employee, you put him on your health insurance subject to whatever waiting period you picked. And the waiting period is the same waiting period you have now. but it's limited to 90 days. Right now, I think you can go 180 days before somebody qualifies for insurance. That's going to be reduced to 90. But that's, you just put it right on your policy, and you don't worry about the measurement period to the following year. Variable hour employees, that big calculation I did, everyone will get assigned their own measurement period. That's the initial measurement period I told you to ignore earlier in the session. So every single person, right, every single person is going to have a measurement period starting on their hire date. You're going to pick what that period is. It's got to be the same for everybody. But if it's like 6 months, then you're going to have a calculation that's running all the time for every new employee for that 6-month period. Then you're going to have your own administrative period if you want it. Then you've got your stability period. While the employee is working for you, and he's in the measurement period or the administrative period, you don't have to worry about being fined for not offering him any insurance, because you've got a safe harbor while you're theoretically deciding whether or not the guy qualifies for benefits. Safe harbor, I just said that. Each employee, I said that. No waiting period. Oh, yes. And so once you put these people in the plan, they go through the measurement period, they come out, you say, okay, you're a full-time employee. I'm now going to offer you insurance. You can't say, and now you're subject to that 90-day waiting period, because they've already waited for however long. So the waiting period does not apply to those people. Okay. Oh, and if someone is in their stability period from when they were first hired, and another standard measurement period comes up, and all of a sudden they don't qualify anymore, you can't cancel them. You have to let them finish the stability period from when they were hired. Okay, real quick, other considerations, because I'm using too much time. There will be non-discrimination rules. They haven't been written yet, but trust me, they'll be there. If you have more than 200 employees, you're actually going to be automatically enrolling employees in your health insurance plan starting in 2015. And if they want out, they're going to have to tell you they want out. 2018, there's a 40% tax on excess benefits if you offer too many benefits as a way to give more compensation to people and not call it compensation. There's a new tax, 0.9% on all income over $200,000. We will be withholding from your payroll if you're in that class. You may end up getting it back because the limit is $250,000 if you're married filing jointly. So when you combine with your spouse, if you're under $250,000, you get that money back. There's also an unearned income tax, which is basically the same thing. Takes that same 0.9%, adds it to the self-employment tax that's already out there of 2.9, and they charge you 3.8% on that. A little math there for you. If you have nursing mothers, you have to let them have a place to express milk where nobody can see them, and you can't make them use the restroom. Maximum 90-day waiting period. A bunch of fees that are going to cause your health insurance to get expensive. Reporting requirements. You're going to have to report to the IRS what you're doing from a health insurance standpoint, so that when the exchange calls, they can tell them whether or not they have a plan that's being offered. Retiree prescriptions. If any of you are covering prescriptions for your retirees, you used to be able to deduct the cost of what you subsidized and get reimbursed by the government. You're no longer going to get reimbursed by the government. And my favorite, the unhealthy lifestyle surcharge. If you have people that have unhealthy lifestyles, or whatever, however that's going to be defined, smoking and things like that, you can increase what they have to pay as contribution to health insurance by up to 30% if they refuse to go into a HIPAA-certified wellness program. If they go into the program, they can avoid the penalties for 12 months. And then I was going to say proposed regulations. All these regulations are proposed regulations. They go out for comment, they come back, they go back out for comment, they come back, and they're going to continue to change between now and 2014 and probably beyond. So now I want to hand this over to Tracy, and I haven't left her much time.
As Tracy comes up, let me give you one quick point, because we often see 90 days as the waiting period to be benefits eligible, but that's usually the first of the month after your 90th day. Well, according to this law, they can't be made to wait more than 90 days, so realistically it may turn into first of the month following 60 days as the longest you can do. Question?
Kevin Davis? Jared?
That doesn't have anything to do with the 9.5%
Get your slides up here.
of the total compensation, right? If they're unhealthy and you can charge them 30%,
It still needs to be below.
still
The
have to
employee
use
can
that.
still not pay over 9.5%.
It's an interesting
Okay.
question. I'll defer to Hans on that one. I haven't seen someone spell it out quite
I
that
will
way.
also
That's a good
defer to
question.
Hans, because I never thought of that. Actually, I thought of it just as I said it this minute, and I said, God, I hope nobody asked that question. All right. This is, I'm going to introduce you now Tracy Miller. She's a shareholder with Ogletree Deacons. I believe a graduate of American University and Harvard Law. She's going to talk about some strategies of those of you now are saying, all right, how am I going to get out of this? How am I going to reduce the impact of this? What are my options? Do I have any options? Am I going to go to jail with those options? That's what Tracy's going to cover. And I apologize for running over my time.
I'm going to give you all that in 10 minutes. Okay, Kevin certainly did a very comprehensive overview. And I'm sure you're all thoroughly confused, as are most of us, lawyers included, when we look at this law. And as he mentioned, it is still changing. Some new regulations came out in December. They're proposed regulations. The government has said we can rely on those regulations going forward, but they are proposed. And there are still some open questions, and we expect to get more regulations as time goes out. So I'm just going to cover, I got a lot of slides here. I'm going to blow through a lot of these and just cover some of the high points just in terms of strategy. You know, it is a choice. It is pay or play. So you need to look at those things. You need to do the calculation and determine, is it something I can afford? And to do the calculation for whether or not you want to play, you take all of your employees, $2,000 per employee for a year, taking out the first 30 employees. That is the number you need to look at to decide whether or not you want to play. Most employers are going to want to play. The penalties for not doing so can be extremely high, as you can see. Whereas if you offer coverage and it's not sufficient because it doesn't provide minimum value, it's not affordable for some employees, then the penalty is going to be much less. It's only going to be $3,000 per employee that goes to the exchange and qualifies for a subsidy and tax credit. So you need to first determine, am I an applicable large employer? In terms of the question of the control group, it is very complicated, and Kevin touched on that point. If, you know, it's 80% or more ownership is the general principle, but what you want to do is you want to look at all the employees in that control group, even if they're owned by separate, different individual companies, lump them together, and then you can decide on an individual basis whether or not you want to pay or play, and there are some strategies there too. So 80%. We went through this, determining how many employees you have. You include hours that they are paid but don't actually work, PTO, jury time, those things. Make sure you include that. And National PEO can help you do these calculations. As you can see, it's pretty complicated. Full-time equivalents. You saw the charts there. You basically, it's 120 hours per month is considered a full-time equivalent. The seasonal worker exemption, we expect to see some more regulations on this. Right now, what the government is saying is using the regulations that are already in place for other purposes. In Arizona, you may have some seasonal workers that are here for the winter months. The problem here is, and what you're going to need to look at, is you do the calculation with the seasonal workers. Then you look back and say, okay, for no more than 120 days, did I only have over 50 employees because of seasonal workers? So you look at that and you can subtract those seasonal workers out for those 120 or less days. So if your season, when you have the employees, is more than 120 days, which often it is in Arizona, that may be a problem. But for example, if you're a retailer and you hire more employees for the Christmas season, that would be an example of a seasonal worker. Certainly there's agricultural seasonal workers in some industries. I don't know if we had any of those here. If you, for example, provide financial services and you hire more people during the tax season, that would be a seasonal worker. So again, if you offer coverage, it's only triggered if someone goes in and tries to and does obtain insurance through the exchange and is eligible for a premium subsidy. The 5% or 5 employees, as Kevin mentioned, you don't have to offer it to everyone. They give you this 5% or 5 employees, whichever is greater. And the reason why they give you this is really it's an administrative convenience, the idea being that you're going to miss people for certain reasons. So be careful in purposely excluding people by saying, oh, I can do up to 5%, 5 employees. I'll just go ahead and pick people. Because if you do that and then you miss someone for some reason, you're going to have been considered to offer no coverage, and you're going to get that big sledgehammer penalty. And the biggest example here that I want to give you is the 1099 workers. I cannot stress this enough. We are seeing in the employment law area, this is a priority in a lot of areas. The Department of Labor, the only thing that's going to get the Department of Labor at your door quicker than a 1099 violation, misclassifying workers as 1099 employees, is going to be child labor violations. They take it extremely seriously. It's given priority. When they find a violation, they then also inform the IRS as a matter of course. So you could hear from them as well. The other thing that's been happening a lot is that the DES is performing audits, because if you have a 1099 employee, you're not paying unemployment insurance. And so the DES, even though they're not actually exchanging information with the Department of Labor, employees go, even if they're 1099, a lot of them go and apply for insurance. They're hearing to do that, for unemployment, and then DES calls you up, and they're doing a lot of audits. So be careful in terms of making sure you don't have too many people that are under the no coverage. Here's just a quick example. If you have 2 companies, one's owned by the other, they each have 120 employees, you can decide, as I said, one company can say we're going to offer insurance, the other can say no, we're not going to. The company that doesn't offer insurance, here's an example of what their penalty would be. For 120 employees, that's looking at a $210,000 penalty. There's special rules for staffing companies. Kevin mentioned the anti-abuse rules. In essence, if you're trying to do something cute, that's where the anti-abuse rules kick in and say, no, you can't start splitting hours between a staffing company and the client in order to avoid the hours being counted. In considering whether or not you can afford the penalty when you're doing the calculation, remember that the penalty is not deductible, whereas insurance premiums that an employer pays are deductible. So when you're doing the calculation, as a rule of thumb, every dollar that you pay in insurance would be $1.40 for a premium. Of course, the soft cost, as you all know, why you would want to provide. Here's one little, a lot of employers are out there trying to find tricks. Here's one trick that we've heard talked about, which doesn't work, I don't think. Let's say you have 60 employees. Couldn't you just form a whole bunch of companies that each have 5 employees? And since you're allowed to exclude 5 employees, don't need to be offered coverage, then you're scot-free, right? Technically, right now, as the law's written, that would work. I think that if they looked at it, they would end up going ahead and re-aggregating everyone and saying that they're all part of the same group. Okay, and in 2 minutes, here's just a couple of, this went through the penalty scenario. One point I want to make that I don't think it was made, is in terms of, you don't have to offer it to the spouse, correct? You do have to offer it to the children. However, in looking at whether or not the coverage is affordable, all you're looking at is the amount of premium that the employee has to pay for a single person coverage. So if you offer a policy, so a lot of employers are probably going to heavily subsidize the employee-only coverage. You can do that, and then for the dependents, you can say, okay, we're going to cover all the dependents, but I'm not paying, as the employer, I'm not paying anything for that. That's okay. In determining whether or not the insurance is affordable, that's not going to be factored in, because if a dependent gets insurance through the exchange, that is not a triggering event. It's the employee getting it. So we'll probably see a shift for people that right now pay for dependents. there'll probably be a shift more paying just for, I would think, the employee. Okay. Yeah, I'll give a couple minutes here. Just want to see if there's anything else. Oh, this is the point I just made. The three safe harbor provisions. I mean, normally the income in a family is not going to be less than a single person makes, but there are certain circumstances where it is, and that's why they provide these safe harbors. In terms of if you have a policy and you don't get the sledgehammer, you're offering a policy, but it's somehow defective. Remember, there's two ways of it being defective. One is it doesn't offer the minimum value, and the second one is that it's not affordable. Not offering the minimum value is the one that's going to cause a lot of problems, because if you don't offer the minimum value, it applies to all the employees. So if they go in, you're going to get hit for everyone that goes in because you're not offering minimum value. If you're not providing affordable enough coverage, then it's only going to be those lower income employees. Those are the only ones. It's not going to affect everyone. So if you're looking in terms of, you know, my policy isn't perfect, make sure that you hit the minimum value. There's been talk about managing employees' hours, trying to keep their hours low as a way to avoid some of the mandate. Be careful doing that. For one thing, you're going to get a lot of employee backlash, of course. Employees may not want to be told that their hours are going to be cut so that you don't have to offer them insurance. That's not real good for employee morale. And there are some provisions that would probably, as the regulations are coming out, are probably going to be passed to prevent that. There may be some other discrimination procedures and lawsuits that may come out of that. That's still evolving. So be careful in terms of managing employees' hours. The control group is very complicated. Let's see. Okay, let me go through real quick these some takeaways real quick. First thing to do is say, can you afford the no coverage penalty? That's the first calculation you want to do. Second one, you may decide we can afford it, but for whatever reason we're going to offer it anyway. If you have a bunch of employees that make a lot of money and they expect it, even though you wouldn't have any penalties, it's something you still may want to do. The independent workers, independent contractors, again, that deeming rule does not give you that much room to spare, so be careful if you have independent contractors. Please take a look at them. Take a look at the tests. There's different tests for all the laws, but take a look and make sure they truly classify as independent contractors. And this is the one that I just said with regard to the potential exposure if you don't meet minimum value. The safe harbors aren't going to help you if you don't meet minimum value. If you don't meet it for one employee, you don't meet it for all. And therefore, all the people that go and apply for the insurance on the exchange and get the subsidy, which they'll get because you're not providing minimum value, even if they make enough money, you're not providing sufficient value, then you're going to have problems there as well. That's it.
Okay, just before everybody takes off, I know it is. Wow, very good. Wrapped it up just about exactly at 11 o'clock.